Hello everyone, this is Dr. Samuel, and today I would like to share with you about cervical cancer, which is conducted in Gondar, in north part of Ethiopia. So my title of topic is gonna be the knowledge, attitude, and practice on cervical cancer screening among the undergraduate female students in the University of Gondar, Northwest Ethiopia, and this is an institutional based cross-sectional study. So let's have a look the abstract part of this paper. So cervical cancer is one of the major public health problem, and in the world the cervical cancer is the fourth most common cancer among the women, and it become the leading cause of cancer mortality in females. And if we look this cancer in Ethiopia, this is the second most common one. Almost every year annually, almost more than 6,000 new cases, and almost 500 5,000 diseases occur annually in Ethiopia. But even though we do have this much of high burden of new cases and diseases, there is a scarcity of data about the knowledge, the attitude, and the practice towards about the cervical cancer screening among the female in the study area. Therefore, the objective of this study was just to assess the knowledge and the attitude of those undergraduates and students towards cervical cancer screening. So to have a look the method of this study, as I said before, this is an institutional based cross-sectional study, and normally it was conducted in April 2018 at the University of Condor in College of Medicine and Health Science, specifically in undergraduate female students. So to study this, a data collection was conducted through having a certain questionnaire by preparing a questionnaire, and it was administered almost 403 respondents, and this much of respondents were recruited by a simple random sampling, and finally the data was analyzed with a software called SPSS, and a descriptive data analysis was used to report the result. So just to have a short look on the result, more than half of the respondent, almost 59 percent of the respondent, they do have a good knowledge, whereas almost 68% of the respondent had a favorable attitude towards the cervical cancer. However, less than 1% of the respondent had been screened for cervical cancer. So to conclude, for this the abstract part, although the undergraduate female students had a very good knowledge and favorable attitude, whereas their practice on cervical cancer screening were really quite low. Therefore, the health sectors and the gender streaming office of the university should mobilize students to strengthen the uptake of the cervical cancer screening practice. So that is just to give you a little bit about the abstract parts, but now I have to go in detail about the background of the this study. So what are the cervical cancer? This is just a kind of cancer of the uterine cervix that cause very serious public health problems, and it can cause a very high morbidity and mortality among the women in the world. And the major cause of this case is the human papilloma virus, which is normally transmitted through sexual intercourse, and this virus is directly affecting or infecting the reproductive tract of those people who are sexually active, especially for the young adult men and even when a woman is. And this HPV, that is the human papilloma virus, had more than 150 types, uh, and types like HPV 16, 80, 31, 33, 35, 39, 45, 51, 52, 56, 58, 59, and 60. These are some of the HPV types which are really identified as high risk HPV due to their high carcinogenic potential, and they can bring a cervical cancer development. And normally, from the HPV types, especially type 16 and 18, are more responsible for about 70% of all cervical cancers worldwide. So, therefore, the HPV vaccine that prevent HPV 16 and 18 infection are now available and very important to reduce the incidence of the cervical cancers. So, what are the manifestation of if a woman have a malignant cervical cancer? So, in that case, there will be a vaginal bleeding between the menstrual period, and also there will be a pelvic pain and even a vaginal bleeding, even during or after sexual intercourse, or in some cases also there will be vaginal secretion. So these are some of the signs if that cancer is becoming malignant and distributed throughout your body. So that is one way. So the best way is to prevent this as a malignant cervical cancer is to identify or the pre-malignant form by doing some cervical screening, and also HPV vaccination is very important to control the disease. If we look in the developing countries, there are so many reasons mentioned as a barrier toward this cervical cancer screening. So some of the most barriers for not making a screening for cervical cancer in this country is one is just due to the shortage or underutilization of the screening facility. We don't have much screening facility. That's why most people they don't they don't do a screening in the developing countries. So what that can be one of the reason for that. And another part is lack of awareness or poor attitude towards the cervical cancer and risk factors. And also, we do have the belief about the cervical cancer is not good, and some of the people also they feel just healthy and the stigma, and also they fear of the test result and fear of their marital disturbance as a result. They are not doing a cervical screening, cervical cancer screening. So if we look this cervical cancer, the rate of the cervical cancer is just 5 times more higher in the developing country compared to the developing one. So that is one of the indication. And another part is specifically to Ethiopia. So this cervical cancer is one of the second most common cancer, and it is also the second mostly deadly cancer among the Ethiopian women. As I said earlier in the introductory parts, almost 6,300 new cases and almost 5,000 this is occurring annually in Ethiopia. Despite the growing number of this cervical cancer in Ethiopia, there is still a gap in knowledge and attitude in the practice towards the cervical cancer screening. And specifically to the study area, there was no any previous study done on the knowledge, the attitude, and the practice towards cervical cancer and its screening. So therefore, the objective of this study was just to assess their baseline knowledge, attitudes, and practice towards the cervical cancer and its screening. So how was how is the methods or the methods of this study? So to start, specifically to the study area, this was conducted in University of Gondar, specifically in College of Medicine and Health Science, which is present in the northwest part of Ethiopia. Normally, Gondar is just a bit far from the capital city. almost 747 kilometer away from Addis Ababa. So this college had given a service for more than 5,400 students every year, and this college has five schools and 12 departments. So during the study in 2018, the total of number of the female students was 1,746. And what kind of what kind of study design was used? It was an institution based, that is referring to the University of Condor, that is one institute, and it was a cross-sectional study. Let's have a look the population, the source population, the study population is. So the source population is gonna be all female students in the college were considered as a source in the population, whereas the study population were always selected regular undergraduate female students in the college were considered as a study population. So with that, just let's have a look directly to the operational definition for the knowledge, attitude, and the practice. So for those participants who scored uh, greater than or equal to 6, a correct answer from the 11 knowledge questions were considered to have a good knowledge. If they had less than 6 answers, then they will be considered to have poor knowledge regarding about cervical cancer screening. Whereas for the attitude, those participants or respondents who scored greater than or equal to 5 correct responses from the 9 attitudinal questions were considered to have a favorable attitude. If they had less than 5, then it is unfavorable attitude. Whereas for the screening practice, the participants who are screened for cervical cancer at least once. Looking into the sample size determination by using the trace field formula, that totally 403 students were sampled. Uh, so that is the sample were among all the 12 departments. And then they use a questionnaire to sample. Yeah, they just to collect those data, and then that questionnaire was first prepared with English and then translated into the local language, that's in Amharic, and then again vice versa for the data entry to check it. And then and finally, as I said earlier, the data management was done, data management and analysis part. The data were entered and analyzed using an SPSS 20 version, and then a descriptive data analysis was used to describe the knowledge, the attitude, and the practice of the cervical cancer screening. And then finally, the results were presented in mean and standard deviations. So a total of 400, just to have a look at the result, just to start with the socio-demographic characters of the participant. A total of 403 undergraduate female health students were included, and the response rate was almost 100%. It was 100%, and their age group ranged from 18 to 25. Uh, and the majority, 18 to 25, that is their age, the age ranges, and their religion was almost 80% of the respondents were Orthodox Christian, and there are now almost 63% is from Amhara. And yeah, regarding their marital status, almost 97% of the respondents were single, and 2.3% were married, and almost 0.2 is divorced, and 1% is separated. So let's have a look the knowledge results. So the first question regarding the knowledge towards the cervical cancer and this screening. Have you ever heard about cervical cancer? That was the first question administered. Then almost 90% of them they know about cervical cancer. And where did you get that information? Then almost the majority they say they got that information from their teacher. Almost 32 8% got from their teacher, and some of them almost 30% they got the information or they learn about cervical cancer directly from the news and the media. So another question is what was the cause of this cervical cancer? Almost 35% of them they say that it is caused by a virus, whereas 13% they say that it is a bacteria, whereas almost 42% of them they don't know about the cause of cervical cancer. Actually, this should not be because they are a medical student, and I don't know why they don't know the majority of them. And what are the most common the symptoms of cervical cancer? And almost almost the majority of them they don't know the symptom of the cervical cancer, but almost 20.8% they say that vaginal fold smelling, vaginal irregular bleeding. 20% yeah, they say it like that. And how can someone with a cancer of cervix can be treated? Then almost the majority they say do not know, almost 26%, whereas 23.3% they say it can be treated with surgery, and almost 23 again is they say that with a specific drug. Again, some of them they say with radiotherapy. And then screening frequency, almost majority, almost 60% of them, screening frequency for cervical cancer is once a year. They say that that is, and the major and 20% they say that every 3 years. And who should be screened? Then almost women greater than 25 they say 48% of them, and 20 of them they say that prostitutes should screen. What about their attitude in a question regarding cervical cancer in the study area? So do you think that it's helpful to detect cervical cancer early? And almost the majority, that is 55.6% of them, they strongly agree with that. Do you believe that do you believe that you have another chance of getting cervical cancer? Uh, oh, majority, yeah, they also agree. Almost 36.7 of them, they agree, but still 26% of them they disagree with this question. The other part is, do you believe that getting cervical cancer is a serious enough for you? Yeah, strongly agree. Almost 58 percent of them, which is very nice. And another one is, do you think that there is an effective method to reduce the risk of the seriousness of cervical cancer? Yeah, majority of them, yeah, answer it. Almost 50% of them they say that they agree with this question. Do you think the carcinoma of the cervix is the cause of the disease? Yeah, 39 percent they agree with that question. And another one is, do you think any woman acquiring a cervical cancer? Yeah, almost majority they accept, they agree with this question. And another one, do you think the cancer of the carcinoma of the cervix can be treated? Yeah, a majority of them, they said they can't be. Almost 42 percent they disagree. Do you think carcinoma of cancer can be treated? They say no, they disagree. It cannot be treated. So the other part is, do you think screening help in prevention of cervical cancer? Yeah, for this question, yeah, strongly agree. Majority of them prevention of cervical cancer. Screening is really very helpful. So that's good answer. Screening is very helpful for the prevention of cervical cancer. And finally, willingness enough for screening. Almost majority they are willing enough for screening. And another one is what are the risk factors? Do you know the risk factors for the cancer of the cervix? So majority of them they replied having a multiple sexual partner can be a risk factor for the cervical cancer, and whereas 15.6% they say that exposure of the human papilloma virus can be a risk factor for having the cervical cancer, and 12% of them they say that early sexual intercourse can be a risk factor for it. Almost but the point here is that the majority of them, that is 33% of them, they don't know the risk factor for cervical cancer. So that is really a bad answer, maybe, because they have to know as a medical student, they are expected not to know. And another part is how can a person prevent getting cancer of the cervix? So here, majority still they don't know. They don't know. 34.7% they don't know, but still 25 of them they said avoid multiple sexual partner is good, and avoid early sexual intercourse is one of the way to prevent have getting the cervical cancer, and stopping the cigarette smoking, having HPV vaccine. And can cancer of the cervix be cured in its early stage? Yeah, the majority, almost 73% of them, they say yes. Ah, that's good. So how can someone, yeah. Another one is a practice. So a practice in a question towards the cervical cancer screening in the study area. So the first question was the sexual experience. So their sexual experience, almost majority of them, they don't have any sexual experience, almost 87.1 of them. And for those who started sexual intercourse, at what age of your first sex? Almost majority of them, 69% of them, they say that greater than 18 years old, and still less than 18 years old, 30 of them started sexual intercourse. And another question is how many number of sexual partner do you have? So far, that is majority of them they do have single, whereas still 36 0.5% of having multiple number of sexual partner. Uh, yeah, have you ever screened for cervical cancer? Yeah, majority of them they say no, 99.5 of them. And what is the reason for not screening? The majority of them they say that I'm healthy. So and some of them they say that it might be helpful, almost 13%, and 28% of them they say that I'm not informed about the screening in a place. And another question is, do you receive cervical cancer vaccine? Almost majority of them, 98.8 of them, they don't know to receive the HPV vaccine, which is really not good, because they can expose them for cervical cancer later on. And what about the pap smear done before? Majority of them, almost 99.5 of them, they don't do that. So in conclusion, despite the university, female students had apparently good knowledge and a favorable attitude. Their screening practice on cervical cancer was very low. Thus, The health sectors and the gender streaming office of the university need to mobilize students to strengthen the uptake of cervical cancer screening practice. So my take-home message here is that screening for cervical cancer for those women is age greater than 30 or greater than 25 is good, and also taking HPV vaccine is also very important, to prevent the disease. And that is my message for today. Thank you for listening. Bye bye.